Yeah. Dr. James J.C. Cooley. The James Cooley Show. It's your life. Yeah.
Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James A.C. Cooley. And wow, we got an absolutely fantastic show coming your way today. Everybody knows that it's Wednesday. So we got Dr. Michael Mantell, 360-degree health, and he has done it again. Another absolutely fantastic guest that we're going to have on today. And we're going to be talking about something that I believe that is so important to everybody, especially in the healthcare business. I'm not going to give it away, Michelle. I'm sorry. How you doing, Dr. Mike? How you doing? I cannot hear Dr. Mike. Michelle.
Hi. Hi.
There you go.
I'm doing well. I'm doing better than the mic was doing. This mic is doing better than that mic. And I'm eager to be able to bring on this really key guest today, who's going to be talking about a very pertinent, very relevant, hot topic, if you will.
Yeah, so I'm excited about that. And Michelle, how you doing today?
I'm doing great. I am doing great.
I tell you what, I want to bring Todd in here. Let's get this thing started. We having a little.
Yo, get ready. It's your life. Yeah. Your life. That's right.
Hello, welcome to the James Cooley Show. It's your life, and I tell you, we got an absolutely fantastic show coming your way today. And Dr. Michael Mantell had done it again, another extraordinary guest. And Michelle is going to tell you a little bit about that in a minute. But how you doing, Dr. Mike?
Very well, thank you very much. It's good to be on again, and looking forward to this phenomenal conversation that we're going to have with this very special guest that we brought on today.
Wow. So I tell you what, wherever you're watching us at, whether you're watching us on E36 Television, Transfer TV, YouTube, LinkedIn, Twitter, Facebook, Rumble, or over 68 live platforms, welcome to the show. And if you want to be part of this conversation that we're going to have today, which Dr. Michelle Cooley is going to introduce in a minute, all you have to do is just go to the platform that you're watching us on, go to the comments, ask any question that you might have. I promise you we'll get you an answer. How you doing, Dr. Cooley?
I'm doing good. Can
you do the honors? Because I want to get this thing started. Introduce the title of the show, the purpose of the show, and introduce this absolutely fantastic guest.
Oh, most definitely. Well, audience, the title of today's show, it is 360-degree Health Day. And the title is Private Insurance Coverage and Recent Events. And Dr. James Cooley and co-host Dr. Michael Mantell, they're having a sit-down conversation with Dr. Matt Mazurek. He's an assistant professor at the Yale School of Medicine and director of Quality and Safety, St. Raphael's campus, Yale New Haven Health. And he's going to discuss health inflation, recent increase in denials and delays in insurance coverage, healthcare expenditures in the U.S. doubling those of other countries with universal healthcare coverage, overhauls to the Medicare program, and universal affordable healthcare coverage for Americans. Dr. Mazurek is a native of Fresno, California, attended medical school and completed an anesthesiology residency at the University of California, San Francisco. He has an extensive leadership experience as a former chair, chief of staff, and medical director of private practices in both Arizona and Minnesota. Throughout the past decade, he has earned an MBA, MHA, and is a fellow in the American Association for Physician Leadership, American College of Healthcare Executives, and the American Society of Anesthesiologists. Please welcome to the show, Dr. Matt Mazurek.
Yeah, thank you very much. It's great to be a part of the show. I appreciate it.
Dr. Mazurek, it is so great to have you here today.
Thank you.
I know you're a busy guy, and even up until 2 minutes before, you were busy teaching residents. And so thanks for taking the time out to be with us today.
Yeah, I definitely know how to pack the time in during the day and make efficient use of it. So, yeah, thank you very much. Yeah, first of all, before we get started, just want to make a quick disclaimer that most of what I say here are solely my opinion, not those of the School of Medicine or Yale New Haven Health. So just to clarify that, these are all solely my opinion.
Wow. Hey, Doc, it's an absolute pleasure having you on the show. You taking the time to come on and educate our listeners and our audience. And I tell you what, one thing that I did not say in the beginning, Dr. Mike, was that if they want to call in, all they have to do is pick up the phone and dial 1-888-344-1170. That's KCBQ AM 1170, answer FM 96.1. That phone number is 1-888-344-1160.
1170.
You know, hey, Dr. Mike, I'm gonna let you start this conversation.
So let's start off by something I read in the New York Times just today. No such thing as coincidences. According to a study that was reported in August from the Commonwealth Fund, which is a nonprofit bipartisan healthcare research foundation, they found that high deductibles and co-payments are causing 2 out of 5 working age adults to delay visiting the doctor and filling prescriptions. Those who do get care can become burdened by medical or dental debt, something that almost 1/3 of working age adults report experiencing. This is really impacting our health care as much as anything else I can think of right now. So I guess the first question is, how do we understand the role that hospital systems, insurers, pharmaceutical companies play in driving these increases? And really, where is accountability for this?
Yeah, no, first of all, that's a great question. I think what we really have to do is take a trip back in time as to how our modern health insurance system evolved. And because obviously we don't have a universal basic, coverage for all Americans. Most other OECD nations do. We're one of the only large economic powers that doesn't guarantee at least some form of coverage. So around World War II, employers used health insurance coverage as a perk or a benefit. And it was definitely at that time affordable. What's happened since then is, of course, healthcare has evolved monumentally, both with regards to technology and things that we can offer patients and what hospitals can offer. And it's completely different than, say, prior to World War II, where there weren't that many pharmaceutical companies. There really weren't that many options for critical care. So healthcare in general has gotten more expensive. And as healthcare has gotten more expensive, the opportunities for us to offer newer technologies has increased as well. So it's all kind of gone parallel and in line. Now, Medicare was passed in 1965, and the primary driver for passing Medicare in 1965 was providing hospital coverage for those who were older. There was a huge segment of the population in the 50s that didn't have any health coverage whatsoever, and hospital coverage was quite expensive. So when Medicare was born in 1965, it provided that first real social safety net. Now, here in the United States, we tried to pass a universal health care coverage plan around World War I, the Otto Bismarck plan, which would basically have every citizen compulsorily buy insurance and participate. The reason it didn't pass is, of course, because there was anti-German sentiment around World War I, and so those efforts failed. And I believe FDR, of course, in 1935, again tried to pass universal health coverage, and it failed once more. So we've really relied since the passage of Medicare in 65 on both private insurance, Medicare, now Medicaid, and a variety of other mechanisms up into the Affordable Care Act.
So what steps can physicians and healthcare organizations take, and patients as well, to navigate the challenges that these obstacles are presenting?
Well, first of all, I think one of the issues in our nation is we haven't really addressed the social determinants of health. And it's a foundation for all of our society to function well. So patients, of course, have to take ownership of their own health, but it's very, very difficult for some of our patients to do so, especially when there's inequities in the delivery of healthcare and there, socioeconomic inequities. We all know that those of us who are employed, and of course we have insurance tied to our employment, not just as a basic part of being a member of our society, those who are younger and unemployed have one of the highest rates of not being insured. And as you alluded to earlier, one of our big problems is, of course, even if you are insured, it doesn't mean you can afford the coverage. Most Americans can't afford a $500 unexpected expense, at least 50%. So if they're part of a high deductible health plan, for example, or if they're part of a health plan that has a lot of out-of-pocket expenses that are expected, they definitely won't try to even enter and engage the system. And then once they have engaged the system, part of the real problem is, how transparent is it? What do we know what things are really actually going to cost when we get the bills? So it's complicated, and it's extremely difficult for most people to navigate.
So why are these denials and delays occurring more frequently? We see that happening. Why is that?
Well, first of all, we have to realize most private insurers are, first of all, businesses. So they have a fiduciary responsibility to shareholders, investors, and as such, increasing revenue, increasing returns on those investments by, denying, increasing prior authorizations. That's one lever in the toolbox to retain basically healthcare premiums. Now, this is the thing about health insurance companies. We now no longer really have a choice to participate in it, and nor do our employers have a choice to participate in it. So we're all forced to participate even through our taxes. So it's a product that we're purchasing that we really don't have an option not to purchase if we're capable of doing it. So if you can't afford to enter it, though, forget trying to even navigate it. So
hold that thought, Doc. We got to take a station break, but I tell you what we're talking about today is we're talking about private insurance coverage and recent events, and we're going to hit up on a lot of different things that's going on out there. So if you want to be part of the conversation, all you have to do is just go to the platform that you're watching this on, ask any questions that you might have, or pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity. Coming up on It's Your Life with James Cooley.
A black man's...
The James Cooley Show. It's your life. That's right.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
on Amazon and everywhere books are sold.
That's right. That's right. It's the show. It's your life. Your life. Dr. James J.C. Cooley. It's your life. Your life.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, we got this absolutely fantastic guest on, and I was just listening to the conversation that him and Dr. Mike was having, and so I got a question based on the conversation. I think you had mentioned something about the United States pays more in spending on health insurance than any other country in the world. Based on your understanding of that, do you think the U.S. is providing the same type or better quality, or maybe less than what some of the other countries are doing? And if that's the case, whatever your answer is, what can we do to make it better, or just enlighten us on that?
Wow. Yeah, great question. First of all, the U.S. 2 years ago, we spent about $12,000 per capita on healthcare. And in most of the other nations with the universal coverage program, at least, they spend about anywhere from $4,000 to $6,000. Now, you would think with that healthcare spend that our outcomes would be radically better. But the reality is we are doing very poorly in maternal fetal mortality, access to dental care, access to pediatric care, access to mental health care, and even access to primary care. These are the foundational, specialties. And basically, by providing these types of services, we can ensure that most people are taken care of. So we're really not doing a fantastic job at that. And I think the other countries have gotten that figured out a little bit better than we do. They understand that access and primary care are the foundation now. And here in the U.S., we've tried a lot to provide that. In the 1990s, with the HMO push, the idea was that everyone would be assigned a primary care physician, and then they would be acting more or less as a gatekeeper, if you will. So the issue with that was people were losing choice, and they didn't want to give it up. And by the end of the late 1990s, people really wanted to have nothing to do with HMOs at all. They wanted to abandon it, and they did. So, and we've had a dearth of primary care coverage here in this country for a long time. So we have access to specialists, but we really don't have an access to the foundation. I think that drives up cost. So
I was just speaking at the American Society of Hematology. I was meeting in San Diego this past weekend. 33,000 hematologists, oncologists gathered here. I gave 6 talks, so I look a little tired. I am. But one of the interesting conversations we had was the role that primary care has. And they were saying that many patients say they prefer going to urgent care today than have a primary care that takes 3 weeks to get an appointment with, and then they're going to refer you to to get scanned and x-rayed, blood tests anyway. Why don't I just go to urgent care? I just go in, I wait an hour, and I get everything I need done. What do you think about that?
Well, patients come in, basically 2 categories. You have the chronically ill who need access to the system all the time, and that's a small subset. It's like, 10, 15, 20% of the population consumes about 80% of our healthcare resources. So, in my 20s, for example, and most of us who are in our 20s, we had health insurance, but we weren't accessing it, and we really didn't need to. On occasion we did, but we didn't have that drive. So I think there are those in society who would prefer to do an urgent care visit for a cold or a sniffle rather than try to see their primary care doc and have that massive inconvenience. So I think there's a convenience attitude, and that's driving a bit of that behavior. The other thing too is the nature of the relationship between patients and physicians has completely changed. Now that most physicians aren't in private practice, the idea of hanging a shingle up in a small town and getting to know the whole family over the course of 30 years, it just really doesn't exist anymore. So there's a lot more, I should say, transient encounters. And, I've, for example, in the last 10 years, I've had about 5 or 6 different primary care docs. Prior to that, I only had 2. So that's what's happening.
You mentioned social determinants of health, and this brings up the American College of Lifestyle Medicine focusing on prevention. And we'll talk about that a little bit as a way of mitigating some costs. But would you please define social determinants of health for our audience?
Well, there's clear evidence that, where we've grown up, what our educational status is, what our marital status is, what the variety of different factors and accesses, and where, what kind of resources we had when we're growing up really have a huge impact on our health outcomes, for example. And the other thing too is, of course, individual factors like diet, exercise, what we eat, and those types of factors kind of come together. If you can imagine, it's kind of in a ball, if you will, that combines all of it, and the outcome is determined more or less on how each one of those factors influences your overall health and well-being. I mean, for example, in rural healthcare areas, there are food deserts. They have access to convenience stores. It's a lot easier to, stop for a fast food on the way home. And if you're, of course, the bad habits of smoking, drinking, and having a sedentary lifestyle really have a huge impact. And that's not really, is it the healthcare system's responsibility to fix that part of the social determinants of health? All we can do is do the message and deliver it and support it. But at the end of the day, it's a society responsibility to address the SDOH, the social determinants of health.
And this really speaks to our responsibility to take care of ourselves. I in my talks to American Society of Hematology, I said, stop treating patients. And they looked at me like I was crazy. Stop treating patients. Like, what do you mean? Yeah, stop treating patients. Start taking care of patients. Patients want to feel cared for. And as I said, the difficulty is if the patient doesn't care for him or herself first, running to a doctor isn't necessarily always the best answer. But I've got to tell you an interesting experience that I had. I had to have some blood work done early this week for annual checkup with my cardiologist. And I asked for some specific tests. And doctor said, sure, get to the blood lab. They said, oh, this test is going to be $450 and Medicare may not cover that. I said, oh, well, I have secondary insurance. Well, okay, I wouldn't worry about it. It'll probably be covered. $450 for an additional blood test that's going to be added to the bill that they know will be covered. So there's numbers that patients see on their bills that are staggering. And yet, where's that money going? Who's getting it? The doctor isn't getting it.
Right. No, that's true. Well, that's the problem. We don't really have good price transparency. In medicine right now, one of the holy grails is achieving what we call value-based care. In other words, we spend our dollars, for example, and we have better quality outcomes. Now, you would think with the amount of money that we spend on healthcare here in the United States, we would have terrific outcomes and quality, but that really hasn't kind of borne out. So, the thing is that test costs $450. You as a patient, for example, if you were to ask, well, how did you come up with that number? You have no idea, and you would probably get lost in any type of an explanation.
Right.
So, we're kind of customers, if you will, to this system as well, but we don't know what the value is because we really don't know what the true cost is and then what the price should be for that service. So that's the conundrum that we're facing.
Are there uniquely American factors like litigation risks or administrative complexities that make cost control so challenging?
Well, on the administrative front, we spend about double other countries. About 12-13% of all our healthcare dollars are spent doing, performing administrative tasks. Believe it or not, CMS, for Medicare, Medicaid spends about 4 or 5%. And most countries spend around 5 to 6% on administrative costs. It's a factor, but it's not a main driver, if you will, for the increased cost. Here in the United States, one of the big drivers for especially the increase in cost for health insurance has been increased consolidation. So, as much as the Affordable Care Act has produced some really good things, one of the problems with all of the mandates for preventive care and some of the other coverages, especially with pre-existing conditions, smaller insurance companies just could not adjust quickly enough to foot that bill. So the larger insurance companies either purchased them or those other little guys went out of business. So now what we have is really we have less market competition for our health insurance. And that kind of consolidation has actually caused some price increases, far outstripping inflation. I mean, we're paying 65, 67% more for our healthcare premiums than we were in 2011, 2012. So, and the numbers are staggering. So,
we're going to pick this up a little bit after the break. Probably got about a minute and a half before the break. There are specific policies that governs what companies can charge, healthcare can charge different individuals based on the situation and circumstances of coming to see them.
What was that again? I'm sorry.
There are certain policies and procedures that healthcare companies have to abide by, just like what Dr. Mike had mentioned a second.
Right. Yeah.
He mentioned that he told him he had additional insurance and it was covered immediately. So can you think about that one? And we're gonna
certainly
station break, and we'll come back. We're gonna start talking about a little policy. We're gonna pick it up. We're gonna get deeper and deeper into this conversation. If you want to be part of the conversation, all you have to do is just go to the comments that you're watching us on, and I promise you we'll get you an answer. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
Hello, I'm Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be to be in the Coffee Book 2023, Unified Brain Z and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Let's go. It's the James Cooley Show. It's your life. Dr. James J.C. Cooley. All right.
Shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. This is a must listen for anyone who thinks they're stuck in life or needs to understand that their current situation is not their final destination. Country Boy, City Boy, A Journey That Ain't Over Yet is the unfiltered truth to provide hope for the future by challenging you to refuse to become a victim of life's circumstance and dare to become an overcomer, because a bigger, better, and more impactful life awaits you. Get the new audio version of his book, Country Boy, City Boy, A Journey That Ain't Over Yet by Dr. James Cooley on Amazon or wherever books are sold.
It's that time. It's your life. Dr. James.
Welcome back to the James Cooley Show. It's your life. And I tell you what, just sitting back here, listening to the conversation, and Dr. Matt and Dr. Mike are incredible. Everybody know on Wednesdays, which is going to be changing, starting next week. 306 Degree Health will be on Tuesdays, live on Tuesday on all the platforms. So I tell you, just to let you know, if you want to lock in on Dr. Mike and all these other fantastic docs that we got on, it's going to be at the same time, 2 p.m. Pacific Standard Time. Every Tuesday opposed to. And I tell you, sitting back here, getting a better understanding of private insurance coverage and recent events. And Dr. Matthews is bringing a lot of insights up that I don't know if you knew about these things, but I am learning. So if you want to be part of this conversation, all you have to do is pick up your phone, dial 1-888-344-1170 again. That's 1-888-344-1170. Dr. Matthew, I had asked a question about certain policies and procedures prior to the break, and I know we had to take a station break, we had to pay the bills. Can you answer that and give us some insight on certain things that policy-wise that healthcare companies can do and they cannot do?
Well, with the passage of the ACA back in 2009, basic preventative care was no longer allowed to be denied, and plus, patients who had pre-existing conditions could no longer really be denied care or access to their health insurance as well. Now, this, of course, caused a huge spike in a number of people who needed either diagnostic testing or procedures. And what I like to use as a good example is, screening colonoscopies. Now it's recommended that anyone over age 45 gets a screening colonoscopy to, detect colon cancer a lot earlier and then get treatment. Patients have been getting that disease, and they've been diagnosed with that disease in a more advanced state as of more recently, and that's why the recommendation went from 50 to 45. Now, you can imagine millions of Americans needing to have this procedure done annually, and the cost for the gastroenterologist, the nurses, the anesthesiologist, et cetera, it does start to get quite expensive to provide that level of care. Now, that does increase costs. Now, we can, of course, not offer this, and then we have people who are going to present in an advanced state. So health insurance companies have been trying to nitpick a little bit at this. For example, with colonoscopies, I know that there was a push a few years ago for one of the big insurance companies to not cover for the anesthetic charge, which, most of us, we use modern drugs and techniques that are safer, and of course we're present during the procedure too to intervene if there are issues. So you do get what you pay for when an anesthesiologist is present. So there is that constant tension, if you will, between needing to provide that care, and then of course, as I stated earlier, the insurance companies want to, of course, earn more money for their premium dollars. So,
wow.
So if there was one change that you'd like to see in healthcare, in the U.S. healthcare system, that could take place tomorrow, what would that change be, and what's your reasoning for that? What's that one change you want to see?
Well, we have a payer problem here in the United States more than anything, and how we get paid for our services drives behavior both from patients, physicians, and hospitals. if we were to expand the number of insurance companies that could offer health insurance and truly have a much more competitive landscape. For example, in Germany, they have the Bismarck system. Everyone has to buy insurance, but there are over 100 different companies that you can choose to purchase insurance from. So when you have an environment like that, they are going to be vying for their, not customers, if you will, but for patients and coverage. And there's more transparency and there's more competition. You have actually more free market enterprises at work. Here in the US, with the consolidation of private insurance, there's less competition. So that drives prices up. So I think that would be the first move. And the United States, we're already set up to do this. A single payer system here in the US overnight would be an absolute disaster. No one would be able to realign themselves very quickly. And I think that the overall sentiment here in the United States is there's definitely we have a trust issue with the single payer system as well. So it works in the UK, but we all know that the National Health Service in the United Kingdom has been underfunded for a decade. And now their whole healthcare system is undergoing some, unfortunately, stressful times, and patients there aren't getting the care that they once did.
Well, along the same lines, are there any disruptive technologies or innovations on the horizon that you see that could help solve some of these systemic issues?
Well, that's the big $1 million question. I'm not a big fan of the new tech and revolutionize healthcare, for example. I think the most revolutionary thing that's happening right now is the access to telehealth. You know, telehealth, for example, patients in rural areas, they could have access to a specialist via telehealth, and they do access, specialist medicine via telehealth. Sanford Health, for example, in the Midwest, I used to work for Sanford. They're building a virtual hospital there in Sioux Falls, South Dakota. And that's a really novel, innovative approach to providing a necessary gap in care. And that's kind of the direction we need to go. Doing wearables and then using artificial intelligence, that's still an unproven platform. That has yet to be seen. But I think right now we have two problems, really. We have the affordability problem. We have the access problem. And that's where we really need to focus on, is having people have the capacity to have access to affordable care. That way they can get into it. And that's the major disruption, is let's go back to the basics. And we can do that. You mentioned the urgent care centers earlier, for example. I mean, those could also be used to access specialists in smaller areas.
Right.
Now, if you think about the big players right now who have tried to enter this space, Walgreens, CVS, Amazon, Google, Walmart, they've all been trying to get into this primary care space. Our problem right now is primary care is not reimbursed enough. The money is just not there. So, we spend a lot of money on the tech. We're not spending as much money as other nations do just on building the basics. So we need to rethink how we're spending our dollars as well.
Wow. Hold that thought. We got to take another station break. But when we get back, I want your thoughts on this tragedy that we just had about a week and a half ago on the CEO of United Healthcare. And the public had a lot of deniers, and that insurance is not taking care of the patients. I want to get your thought on that. I know Dr. Michael Mantell asked a little bit about that, about taking care of the patients. So I tell you, we're going to take a station break. We're going to come back. We're going to pick it up. We got a lot more of this great discussion that we're going to talk about. And again, if you want to be part of the conversation, all you have to do is just go to the comments where you're watching the show at, and leave an answer, ask a question, or pick up the phone. Dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life. And we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black man's point of view.
Dish-style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
Check it out, check it out, check it out. Your life with Dr. James.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you what, we should have packed about 2 hours in this, Dr. Mike. There's so much information that Dr. Matt is sharing with us, and this knowledge. I mean, a lot of times we don't understand because we don't know. So it's important that we have these discussions as often as possible. And Dr. Matt, if I tell you, if I would love to have you back on the show if your schedule permits. I mean, this is the discussion that our viewers and our listeners need to get a grip and get an understanding that there are people out there that's going to tell them how it is and the rules and regulations and just get them the straight scoop, because right now I believe that there is a distrust in the healthcare, especially a lot of the companies, that they're not really taking care of the patients, but they are reaping in all of the money. So with that being said, with the recent tragedy involving the CEO of United Healthcare in New York City has led to the public discussion on private insurance and recent increases in denials and delays in coverage. Is what can we do to ease that pain? What is true and what's not true? Is there been an increase in denial and the patients are feeling that they're not taken care of? What what recommendation would you give to the healthcare industry and help ease some of the patients' concerns?
Well, I think we need to ask ourselves fundamentally as a society and as Americans, do we want to continue to profitize healthcare, or do we want to view healthcare coverage as a greater part of being a part of the community and at least having some kind of basic access to it? Speaking to the recent tragedy, of course, violence is never the answer, and it certainly doesn't solve anything. And this was very tragic. I was heartbroken when I heard about this, because this has a profound impact on not just Brian, who was killed, but his family members and the family members there at United Health. I think we have a tendency to villainize things when we see or sense some injustice. And I think what we need to do is take a step back and realize that we all probably feel a great deal of frustration. Now, is that frustration, is it actually legitimate? In other words, should we feel frustrated? And I think most people do feel frustrated. I know physicians, for example, and I'm on LinkedIn a lot, they're very frustrated about the number of increases in prior authorizations. And if you talk to some of the specialists, they'll sit there and go round and round with health insurance companies trying to get procedures approved, treatments approved, even diagnostic testing approved. So if you think about it, that takes time away from taking care of patients for the physician. It increased the administrative cost and burden for that physician. And really, it does lead to moral injury of the physician. Most physicians, and I know some people don't agree with this, but most of us are acting in our patient's best interest, and we act with an ethical and moral compass, and we want to do what's right. That's why we became physicians. So we're holding this mantle of wanting to provide good care. And then when we run into these roadblocks where there's a prior auth problem or even a claim denial problem, et cetera, it makes us challenge our own and question our own clinical judgment, if you will, indirectly. And it does have an impact. I mean, there are numerous cases where insurance companies have denied claims for medically necessary care. And if this happens on a more frequent basis, I think that's what's fomented a lot of the frustration and kind of anger, if you will, at the system. I mean, if you think about it, we're paying a lot of money for our own premiums, and we're also paying Medicare taxes. So we're paying a lot of money, and then when we don't see that return on what we're paying for, that's what we're at least seeing today. And unfortunately, this event was a catalyst for that conversation. And I had to just basically step off of social media for a while because he didn't deserve that. And it's still pretty upsetting a week later.
I think that was just eloquent. And I hope everyone heard that and lets it sink into their heart. There's a difference between the physician, the doctor, I don't like to call them providers, but the doctor, and the healthcare system for which that doctor has now become an employee of. Patients connect with the physician. Mm-hmm. The physician and the patient both are victims of the system in many ways. And I think we have to remember that. I hear more and more of my clients talk about that they saw their doctor and the doctor was complaining about staying up till 2:00 in the morning with electronic health records, or how tough it is lately. Physicians are burning out, and upwards of 60%, 65% even are complaining of burnout. Over 100,000 have left medicine in the last couple of years because of this. So the system is difficult. But I want to end this on a positive note, because I think there's a lot more positive than there is negative. You have been at the forefront of patient safety for many years. What are some of the most exciting trends or emerging issues that you're seeing coming down the road that could help continue to reshape patient care and safety in the future?
Well, wow, that's a huge thing to try to, grasp around. No, I think once
The
we
secret is to get you to come back and talk about that.
Right. No, exactly. No, I think once we get some of the payer problems fixed, for example, I think there's a real pressing need for rural, healthcare to get addressed, and many hospital systems are feeling financial and fiscal strain because CMS is underpaying both physicians and hospitals. And of course, what we've discussed here is private insurance has been subsidizing it. So those financial challenges absolutely have to be addressed. Otherwise, we simply can't move forward with any kind of strategic vision. I think we're going to start having those conversations. I think we need to have these conversations. And I'm optimistic, and I'll tell you why I'm optimistic. First of all, I'm here at Yale, and these young physicians and medical students who I'm teaching right now, they are excited. And they remind me of who I was 25 years ago when I went to med school. And they're choosing a life in medicine for the same reasons I did. However, they are entering an entirely different world than the one in which I graduated from back in 2000. It's completely different. The challenges are still there, but this group coming up, they're smart and they're innovative. And the other thing that they really want, and I think we need to really start addressing, is equity and access. Really, we need to really start looking and focusing on the fact that our healthcare system has, in general, had a legacy of not serving those who need us the most. So,
while we're almost down to the last minute and a half of the show, how can people reach out and get in touch with you if they want to chat with you, learn more about you, or read some of your articles? How could they get in touch?
Oh, LinkedIn's the best way to do it. So I have about almost 8,000 followers there. I write regularly, chime in a lot on different posts. So, and I've been doing that for years. I don't know if I've written 50 or 60 articles yet or not, but, I've written history of hospital health, hospital systems. And so there's just a variety of topics. So,
well, I would love to have you back on the show again to talk a lot more about this. And I'll tell you what, I want to thank you so much for taking the time to come on the James Cooley Show. It's Your Life, E360 Health, Dr. Michael Mantell.
Yeah, so thank you.
Thank you for that.
Thank you very much.
Dr. Michael Mantell for always coming up with the best guest in the world. I tell you, to me, that's what it is. I'd like to thank Dr. Michelle Cooley for putting together another outstanding show. I'd like to thank our studios in KCBQ AM 1170 FM 96.1 in San Diego. Always, always, always dream big, think big, and be big at everything that you do. We'll be back tomorrow, same time, same place. It's your life, and we'll see you then.
Hear the latest reporting and analysis on the big stories of the day on the Daybreak Insider podcast. It's top-notch reporting from SRN News, along with the sharpest insight from Hugh Hewitt, Mike Gallagher, Dennis Prager, Sebastian Gorka, and the voices of talent